6:17 right now. Our coverage of former President Joe Biden's cancer diagnosis continues. His office announcing that the former president is battling an aggressive form of prostate cancer that has spread to the bone. Dr. David Geier here to tell us what this means and what his treatment might look like for the type of cancer he's battling. Thanks so much for being here.
Oh, absolutely.
We should mention you obviously can't speak to the president's diagnosis, just the type of cancer that he has. Tell us a little bit about this. This is prostate cancer that has spread to the bone.
Right. Prostate cancer, first of all, exceedingly common in men, especially older men. His is a very advanced form, which is what makes this a little unusual. It's typically diagnosed much earlier, but Gleason score of 9, very, very advanced, and specifically grade group of 5, very advanced. And the metastasizer spread to bone makes it very advanced. It's sort of late stage in the treatment. It takes surgery off the table as a treatment, and then you're looking at some other treatments, but in terms of prognosis and treatment, much more serious than we typically see with prostate cancer.
Yeah, and you mentioned surgeries off the table. With this specific type of cancer, would chemo be likely, or radiation?
Potentially. They're saying, again, this is all just based on media reports, that it's hormone sensitive, and that typically means some type of treatment to lower testosterone, because testosterone basically helps prostate cancer spread, and that can be a different medications, either to lower testosterone or to block it, and then, like you mentioned, chemotherapy. The radiation could potentially be a treatment given the metastasis to bone. We'll just see, given his different health issues, whether or not that's something that they would do.
And then in terms of prognosis, again, you can't speak to the president's prognosis, but when you're looking at a patient with a serious and aggressive form of cancer like this that has spread to the bone, what type of prognosis?
Yeah, I mean, typically the Gleason score, the lower the number, the longer, or the better the prognosis, longer, and then you get higher when you're talking 9 in his case, or 10. You're talking 30, 40% long-term survival. The bone metastasis, I think, is what is typically worrisome. The studies we have show that when you have prostate cancer that spreads to bone, you're typically looking at a median survival of about 21 months, so less than 2 years. Again, these are studies. It may not apply to him, but that's what we typically expect.
Yeah, certainly wish him the best. In terms of awareness, of course, you mentioned that it's a common cancer. What would be your suggestion to men out there watching and getting checked from the doctor?
2 things I would say. One is there's a blood test, a PSA, prostate-specific antigen, and especially after the age of 50, that becomes part of your normal lab work that you get every 2 to 4 years with your physician. If you have high risk family history, certain genetic things, maybe you might start that in your 40s. Also, if you start having urinary symptoms, increased urinary frequency, especially going at night, painful urination, burning urination, a lot of times that can be a sign of some urologic condition, and that may be part of it, be it a PSA blood test or a digital rectal exam, but try to catch this early.
Yeah, absolutely. Dr. David Geier, thanks so much for being here and sharing the news with us.
Thank you.